All right, for the second technique, we are going to work on, now that we have the calcaneus, the ability to distract away from the talus, now in that distracted position, we're going to work on the ability for it to shear medially, okay? So the most complicated part about this is really everything, actually, no. But the setup is a really hard part of this. So you have the client or patient lying on their side. If they have a bit of a hypermobility in their knee, you may want to support it with a pillow. We have a half foam roll that goes under the ankle. And then I have the belt that she is going to use to assist into that maximally dorsiflex position. The next component to this is I am going to use my index finger specifically to go just distal to her medial malleolus onto her talus, all right? Once I get my finger there, it's just going to rest, and then I'm going to position the foam roll directly underneath my finger, okay? So that is going to form a block so that when I mobilize the calcaneus is moving ideally independently of the talus, so I'm getting that medial shear. So take her maximally up into dorsiflexion. She's going to pull up. The other thing that I want you to notice here is my knee is going into a valgus moment, but I'm not putting a ton of weight through that leg, all right? I'm shifting my weight into her foot, and I am plantar flexing, pushing through my trail leg, or my right leg here, so that I can allow my arms to stay relatively straight, and then I can drop down over her foot. All right, so I'm not really using my left leg as a base of support. I am outside of my base of support, pressing into her foot, dropping into her calcaneus so that I can mobilize it that way. Okay, so now I have all the slack taken up, and she is going to plantar flex into my leg. And you should not see motion happen with this. If you do, and let it go. You do not have them efficiently locked out. Good, and again. And let it go. And so I am effectively, this is lateral. So I'm effectively taking her all the way up and just providing a pure shear of that calcaneus down towards the table. So that is medial shear of the calcaneus.